This is the criteria for my extra credit sinus trigger. First image is the PA Caldwell. First off, you want to make sure that you have proper collimation, a marker in the image indicating the anatomy, a good technique to penetrate through the skull. You want to see the frontal sinuses. You want to see the anterior ethmoidal air cells above the petrous ridges. You want no rotation or tilt, and you check that between equal distance between the lateral borders of the orbits. And you want to make sure that, making sure that the petrous ridges are about symmetrical, and that the mid-sagittal plane is aligned. You also want to make sure that the petrous ridges are in the lower thirds of the orbits. For the second view, we have the parietocanthal, or the waters view. And you want to have, once again, proper collimation, marker the image, good technique. You want to be able to see the maxillary sinuses. And you want the petrous ridges lying below the maxillary sinuses so that they're not in them. You want no rotation, and you check for that by having equal distance between the lateral borders of the orbits, and by checking to see that the orbits and the maxillary sinuses are symmetrical. The next view is going to be the lateral sinuses. And you once again want proper collimation, good technique, and a marker in the image. You want to make sure that all sinuses are demonstrated. That's the frontal, the ethmoidal, the maxillary, and the sphenoid. And you want no rotation or tilt, and you check that by having the sella turcica in profile, superimposed orbit roofs, and if your mandible is in the image, having a superimposed rami. The last view is the SMV. So you want proper collimation, have good technique to penetrate through the skull, and a marker in the image. You want the sphenoidal and the maxillary sinuses demonstrated. You want no tilt, and you check that for equal distance between the lateral borders. And you also want the IOML parallel to the IR, and you check that by the superimposition of the frontal bone, the anterior of the frontal bone, and the mental protuberance. This one's slightly off, but really good. And you want the mandibular condyles anterior to the petrous pyramids. And that is the evaluation for the sinus trigger.